I chaired the breakfast session, the 5x5 Insight session, and we had 5 presentations from 5 different clinicians. We heard presentations of service change, which were really quite innovative, and the lessons that came out of that for all of us, I think, were the importance of good leadership, the importance of persisting with change even when it gets really difficult, the importance of engaging staff and maintaining that engagement and not just doing one-off consultations, and the importance of preparing. Doing a lot of preparation makes the project much more likely to deliver in the long run.
For ourselves in secondary care, we've had other benefits, such as far more time to deal with more complicated patients, so that the patients that our skills are best suited for, we get more time with them. And that's allowed us to redesign our job plans in our clinics. And we've also been able to initiate a number of other services out in the community by releasing us from these patients that we no longer need to see, and that can be very well dealt with in primary care.
What we've been able to demonstrate in Cardiff is that we have been applying the principle and the practice of prudent healthcare in terms of taking a quality improvement approach and particularly focusing on reducing harm, waste and variation, but more importantly using the principles of co-production to have the patient at the centre of that. And what we've been able to demonstrate is that you can deliver better for less, and that it does benefit the patient, it also benefits the service and the organisation, because you can remove waste, harm and variation from the system.
I think the biggest surprise that I've come across is the willingness of people to actually engage in this process and to take the agenda forward. I think it's challenging times for the whole of the NHS. You know, we're under increasing constraints to save money each and every year, and I think just the willingness of staff to actually take that forward and to implement changes, I think has been really helpful, and there is a real goodwill out there to actually do things properly for the population.
The biggest surprise is what I found was the education of the juniors, meaning the juniors are more interested in this model. They have an opportunity to learn more from our hip fracture unit, because this is a focused unit, focused standards of care. So not only the junior doctors, the nurses, they have an opportunity to learn. So nurses are more interested, more focused, they have an opportunity to learn. So we have been running more and more educational programs for the juniors, for the nurses. And another very big surprise came to me was orthopedic juniors and medical juniors working together. I did not anticipate that, but it was pointed out to me that 2 sets of juniors, previously they were working in different compartments, now they are working together. So I realized, oh yes, something very new has come which I did not anticipate.
It's brought a lot of different teams together and inadvertently integrated us in a very positive fashion. It's opened up a lot of other communication channels, and a lot of trust is built up between the services, so that we're all used in the most appropriate fashion for the patient welfare.
10% of patients who come into healthcare systems in the developed world are likely to come to harm, and probably a third of that is avoidable. And I think prudent healthcare makes us think more carefully about that harm we do and how we might avoid it. But it really was quite exciting, and we had a lot of the themes of prudent healthcare already being delivered within the system, and I can only see us stepping up from that.